Many of you know what is thalassemia, but those who came first, for them, a short clipping. We say strike of thalassemia, or we have given a symbol T. It's a deadly but totally preventable, containable. Thousands of thalassemia babies are born every year because of our ignorance and carelessness. Through this initiative, we are trying to create awareness, which is the only way to eradicate this menace. Change it, please. We stayed indoors, covered our face as government gave the directive to control COVID. Media gave full support, 200%. The news COVID became viral, dramatically and effective. But as I told you, even after 97 years, we know very little about thalassemia. It's a dreaded disease of children. It's children, something like polio. Purely a genetic disorder, no infection. Never infectious nor contagious. Only carrier of thalassemia trait patients together give birth to a thalassemia affected child. Otherwise, never, never, ever. A human-made curse to society only by the unawareness and ignorance. Well, affected is permanently 100% disabled. That is very important. 2016, government circular says that thalassemia is 100% disabled and with no insurance coverage. So the treatment is horrible. Unfit for army, flying is contraindicated, unsuitable for flight duty, and body contact games. As I told, no blood, no life. Lifespan is 25 to 30 years. Nowadays, it is said that you can extend it up to 50 years or 60 years, provided you have the capacity to spend 1 lakh rupees per month. If you can do that, probably you can keep someone alive. But remember one thing. A thalassemia patient, if lives for 50 years or 60 years, that means if we increase the span of life, automatically there is a chance of osteoporotic fracture of the bones without any trauma. In one of my patients, she reported in the chamber, she has taken already 1,200 bottles of blood. Her age is 43 years. She stays near Manarpukur. She reported with 4 bones fractured in 2 limbs without any injury. And her hemoglobin is 4 grams only. We have to keep hemoglobin up to 10 to 12. Otherwise, you cannot keep the baby well. Treatment is painfully costly. It is painful, again, painfully costly for the family. Unaffordable. Parents spend about 20 to 30,000 per month. And I said international recommendation is 1 lakh per month. Government spends 15,000 to 20,000 crore per year. 3 to 4 lakhs babies with a severe hemoglobin disorder are born each year because we do not test before birth. Shekhar, I told you, this is not a local problem. This is not endemic. This is a global issue. Throughout the world, it is spread. 4.83% world population, that is 200 million, is carrier. 1/8 carrier in India. 10% of the total thalassemia birth, that is 10 to 15,000 new addition every year. Over and above 1 lakh, those who are there. Beta thalassemia, 1 lakh babies are born per year worldwide. 15% of the American, they have alpha thalassemia. It is common in Asia. I showed you global, now it is Asia. Because of too much of international migration. Thalassemia carriers need no treatment. Amitabh Bachchan is a thalassemia carrier. Abhishek Bachchan is a thalassemia carrier. Jaya Bachchan is normal. So Abhishek is a carrier, not a thalassemia. They can never have thalassemia. So we don't have to just look at only to see the pictures of that. 90% birth occur in low and middle income countries, and 3 to 4 lakh babies born with severe hemoglobin disorders globally every year. Can we strike off thalassemia? The question is for Bobby, Hakim, and President. We can. Can we? We can. How? If people do the premarital HPLC test or carrier detection test, just simple test in the government hospitals free of cost. Absolutely free of cost. And in the privately it is 800 to 1200 or 1400.
In all the municipal hospitals also.
That is what I'm telling you. Absolutely. Only thing is one of the couple. Now okay. Now if we are successful, if both of you shake your hands and decide to kick thalassemia out, then what we can do? Millions of children is saved, millions of dollars saved, millions of bottles of blood. I tell you one thing, millions means 2 million bottles of blood per year in India is necessary to keep them alive, not the treatment. Just to keep them alive, 2 million bottles, that is about 60% of the total collected blood, and 40% is remaining. Yesterday you say 20,000 heart operation, they need blood. Where from they will get the blood? It is the $1 million question, and it is your decision whether this $1 million should go in this side or that side.